From the American Diabetes Association, diabetes is a problem with your body that causes blood sugar levels to rise higher than normal. This is also called hyperglycemia. Type 2 diabetes is the most common form of diabetes. If you have type 2 diabetes, your body does not use insulin properly. This is called insulin resistance. At first, your pancreas makes extra insulin to make up for it, but over time it isn't able to keep up and can't make enough insulin to keep your blood glucose at normal levels. Hi, I'm Selena, and today we'll be looking at diabetes, specifically type 2 diabetes. We'll learn about what it is, the symptoms, prevention, and hear a short interview with someone who has experienced diabetes. Type 2 diabetes, once known as adult onset or non-insulin dependent diabetes, is a chronic condition that affects the way your body metabolizes sugar, or glucose, your body's important source of fuel. With type 2 diabetes, your body either resists the effects of insulin, a hormone that regulates the movement of sugar into your cells, or doesn't produce enough insulin to maintain a normal glucose level. Type 2 diabetes has become a growing health concern here in the U.S. in the last couple of years. As of the latest data, an estimated 387 million people globally are diabetic, with 29 million of those people Americans. About 90% of all these diabetics are type 2. America has also seen its rise of childhood type 2 diabetes in recent years. Most people make a connection between this and the rise in childhood obesity at around the same time. Because of this, an increased public awareness of type 2 diabetes is needed currently. Very few people in impoverished nations with type 2 diabetes ever find out about their condition. People with type 2 diabetes often have no symptoms at first. They may not have symptoms for many years, but early symptoms of diabetes may include bladder, kidney, skin, or other infections that are more frequent or heal slowly, fatigue, hunger, increased thirst, increased urination, blurred vision, or pain and numbness in the feet or hands. Diabetes can affect many parts of the body in the long term. The eyes can develop cataracts, glaucoma, or retinopathy, and eventually blindness. Diabetics can eventually develop kidney disease, signified by multiple symptoms. The heart and brain are affected, as there is a greater chance for a diabetic to experience a stroke or heart disease. The feet will have poor circulation, which may result in a worst-case scenario of amputation. High blood sugar affects the body's nerve endings and can even be completely damaged. Obviously, a diabetic's family and loved ones will be affected by their disease. Friends and family can help support this person by reminding them to take their insulin, organizing a diet or meal plan for them, and even by being there for moral support, as diabetics are more prone to depression and stress than others. A major step towards avoiding developing type 2 diabetes is to eat healthy and get plenty of exercise. Many people diagnosed with type 2 diabetes are often overweight or obese, have a low fiber, high sugar and fat diet, and do not get enough exercise. Obesity is one of the biggest causes of type 2 diabetes. A staggering 69% of adult Americans over the age of 20 are considered overweight or obese, and this puts them at up to 4 times higher risk for developing type 2 diabetes. Around 90% of type 2 diabetics are considered overweight or obese. There is some genetics involved, as some are more likely to develop the disease than others, but most doctors and physicians agree the main factors involved are a lack of healthy diet and exercise. The same advice on avoiding type 2 diabetes can also be given to help cure some of their type 2 diabetes. Many doctors and physicians recommend their diabetic patients to improve their diet and exercise. When did you discover you had diabetes? Around October to December of 1998, while I was pregnant with my second child. How long did you have diabetes? Until March of 1999, when my child was born. What lifestyle changes did you have to make? I ate less carbs. Did you have to take any medication? No, I didn't want to. I didn't want to harm my child, and I knew that my diabetes would be temporary, so I thought I didn't need to.